question?
No.
Yes.
Pictures.
Yes.
No. Yes.
Okay, we will call this meeting of Sunny County Commissioners to order. Please join me as pledge. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Please assume an attitude of prayer. But thank you for the opportunity to gather about doing the business that we do for the public for Seneca County. Be with us and guide us and give us the knowledge and wisdom needed to make appropriate decisions, to have adequate discussion, and to know that we're listening to do the best service that we can for you and for all. As we address an important issue tonight and have the opportunity to have authority to speak to us on that topic that's plaguing our county, our state, and our country, may we receive knowledge and wisdom from you in doing our best to offer the service needed for a better society. In your name we pray. Amen.
Amen. Okay, roll call.
Commissioner Kirschner?
Here.
Commissioner Stacy?
Here.
Commissioner Thomas?
Here.
Okay. I will accept the motion to approve the digital audio video recording of the previous board session that was held Tuesday, January 24th, and the written index of the meeting.
So moved.
Second.
All those in favor signify by saying aye.
Aye.
So, we have this evening with us Attorney General Mike DeWine. We are going to ask Mr. DeWine, Attorney General DeWine, to speak with us first. But what I'd like to do is, this is a follow-up to an addiction awareness meeting that we actually had at Oil Face Ministries that Attorney General DeWine was good enough to be here for, and talk to folks in Seneca County who were involved in attempting to mitigate the problem that we are having with heroin and other types of drugs. Rick Hsu, do you want to kind of bring us up to date on what's happened since that meeting and where we're at from your standpoint?
Yes. We really, after the meeting, we really worked with two of our treatment agencies to actually increase number of hours of services for the county jail, as well as working with the local judges for the ones that are on probation or on community control to make sure they can access services quicker. We increase funding for inpatient detox beds for individuals in our county to be able to access inpatient detox beds. The closest facility for us is Lucas County, so we really have to send our individuals to Lucas County, Toledo area, to access inpatient detox beds. It's a little bit of a challenge because, as you guys might know, some of these individuals don't have private insurance, they're not out of Medicaid, and some inpatient facilities are not taking Medicaid. They are private pay, so obviously it's very expensive for us as a board to sometimes help those individuals. We had 2 additional overdose deaths since our November 15 event. We actually just compiled a report today. As of today, we believe we have 9 confirmed overdose deaths in 2016 in Seneca County. So that's a little summary. I will tell you guys that we do have, as you guys, Commissioner might know, we do have a very active opiate task force, and I really want to commend Seneca County leaders for being part of it. We as a board cover 3 counties, and I represent the Northwest Ohio board down at the state level, and this is really unheard of. I think what we are doing here, having all judges in this county, and the sheriff and drug task force and treatment agencies and prosecutor's office, Department of Health, Department of Job and Family Services, all in the same room once a month to really navigate the system and see what we can offer for these individuals. Now, I really like to commend the sheriff's office. We moved from offering a little bit of counseling to offering counseling and Vivitrol and transportation and re-entry services and all sorts of services that I think is really helping individuals. We began with really low success rates, and I think right now the best success rate that we are seeing is with individuals on medication-assisted treatment, which is Vivitrol. We will offer them the Vivitrol shot to 2 2 different agencies in Seneca County. Again, I think that so far has seemed to work the best. Now it's very expensive for some of them, but for some of them it's covered under Medicaid. We're even trying to find ways how to help these individuals. I think for us moving into the next fiscal year, July 1, it's extremely important to be able to keep services going on in the Seneca County jail. Currently, we operate under a grant. They will receive a 2-year grant. They will end June 30th. So we hope there will be opportunities for us to continue the services there.
Good job. Thank you very much.
Thank you.
Attorney General DeWine, thank you again for being here this evening. It's twice in a couple of months you've been up to talk about this situation, and we appreciate the attention of Seneca County. Can you bring us up to date from the state standpoint where things are?
Sure. Maybe I can stand over here so I can look at everybody. First of all, that's a great report. The idea of what happens after the meetings is the most important thing. And so congratulations for having the meeting, but really congratulations for what you do afterwards. And putting everybody together in the same room, there's no substitute for that. Sometimes that's just not done. But we've got so many different, we've got our treatment people and people, social service people, and we've got our law enforcement people and our educators, and just trying to get everybody in that room, I think, makes all the difference in the world. Maybe I'll give you the perspective of what I'm seeing statewide. I guess there's good news and bad news. The bad news to me is I don't see that we've hit bottom. I should be going that way. I don't think we've hit bottom yet. We're still dealing with last year's statistics, which we think 8 people die every single day of an overdose of drugs in Ohio. My guess is that's higher than today. And if we want to see the gravity of that, think how many people would be dead if it wasn't for naloxone, Narcan. And I don't know what the numbers would be in Seneca County, but most counties, those numbers are just astronomical, how many times they're administered. The next thing we're seeing is taking more Narcan, naloxone. Instead of 1 dose or 2 doses, I'm hearing now from emergency squads 8, 9, 10. And that's generally because of fentanyl or and then even worse, carfentanil. We put out a advisory to law enforcement about 6 months ago, don't touch the stuff. If you don't know what it is, don't touch it. Don't field test it, just because this carfentanil is lethal. They tell me it's lethal. It could even be lethal. It just hits your skin. So this is much tougher. I mean, it was tougher to be a law enforcement officer today. It's very tough to be EMS person and have to respond to that and deal with that. So the good news, though, is I'm seeing communities like yours starting really to fight back and starting to pull people together. And what we have found as we observe this in counties is it takes the whole community. So you got to get the business community involved. You've got to get the educators, the law enforcement, social, different service clubs, but you also have to have the churches. The churches, it's very few ministers or priests who stand up there, rabbis stand up there on a weekend and don't look out in their congregation and aren't seeing somebody, they may not know it, but somebody who hasn't been touched by this heroin problem. The face of heroin is the face of Ohio. And, to think that we would have heroin and other opiates that people would be overdosing in Seneca County is just, I think it tells us the gravity of this. And you're not alone, it's in every single county. So I think, at least from what I heard, and I talked a little bit to the sheriff as well, talked to the mayor, it seems to me that you are doing some things that are very good. We are putting on another conference. I did a conference a year ago where we brought in people from all over the state. We're doing another one on February 14th somewhere in the Columbus area, and I can get you all that information, but it's not just for law enforcement. We put a lot of work into the conference, and what we did last year at the conference, we're going to try to update this year, and that is simply to look at what is working in Ohio, to look at and hold up communities that are doing the right thing. I mean, this has got to come from the local community. But by putting everybody together, we had about 1,000 people in a room last year. I think we'll have at least that many this year. Send somebody to come, because what we're going to highlight is not Mike DeWine telling people what to do, because that didn't make any sense. But what we're going to say is different communities are going to talk about, we're going to try to highlight what different communities are doing that seems to work. And I think that's the only way we learn what works, and I'm convinced it has to come locally. And it's not easy. We're not going to turn this thing around overnight. The other thing I think we need to do is, and I put a working group together along with the Speaker of the Ohio House and Senate President. They're about to report in the next few weeks. And we had them look at the whole question of prevention. Not at treatment, not at law enforcement, but how do we do a better job so that people don't start down this pathway. And they're going to come back with some recommendations. So those of you in the news media, they're coming, and they're going to have the recommendations. But I would just speak for myself. I was on Ronald Reagan's National Commission on Drug-Free Schools in the 1980s, and every expert that came in said, if you're serious about prevention, you have to start in kindergarten. And that may shock some people, but it has to be age appropriate. We're not talking to kindergarten kids about heroin. You're talking about, maybe don't take a pill unless your mom gives it to you, or unless, it comes out, somebody who your grandmother, somebody gives it to you, and don't just pick something up, and things that are age appropriate. But what we've learned is you have to start in kindergarten, you have to do something every single year, and all the way through high school. And it has to be age appropriate, and it has to be also something that has been proven to work. What we as adults think works in regard to convincing young people not to start down this path sometimes just doesn't work. And we're not them, and we're not in their position. And so you have to really look at what has been tested to actually work, and that we know actually will work. So we're coming along, but we're not out of this. We're not even beginning to come out of this thing, and I think it's going to continue to overwhelm us. And as I say, as they're moving to fentanyl, it means you're going to be using more than Narcan, more than naloxone to save somebody, and that's you're seeing that all the way across the state. And we have no county that really is exempt from this. And every single county you go into, this is what we find. More happy to answer any questions, but I don't pretend to be the expert, but we're dealing with this every day.
Any questions, folks, for the Attorney General? Ken, what are you finding out in the field? I mean, how many have we had? 9? You said?
8.
Your chat?
8, and I believe 2 are pending for this year, 2017, but last year 8.
The Attorney General alluded to, you wonder how many we would have lost had we not administered the drug. You got an estimate on that?
Right. Well, I'm Ken Majors. I'm the EMS director. The thing that we have found is it goes right to what Attorney General DeWine said. We're using a lot more Narcan on individual patients. It used to be you could spray 1 dose up their nose and they'd wake up. Now it's you just squirt a dose up their nose, you squirt another dose up their nose, and the medic gets on scene, we start an IV, we give a couple of doses IV, and then we see them start to come around. They're not just waking up like they used to. And that's the intensity of the medication that they're on, and I think also the level of addiction that the patients have reached. A lot of them have built up such a tolerance for the medications that they're taking that it requires more Narcan and naloxone to reverse the medication. That's pretty much it. So through our partnerships that we have created with Mental Health and Recovery through Mirch's group, we're using grant money to put Narcan everywhere. We've got Narcan in all the fire trucks, all the EMS vehicles that have had it, but now they've got multiple doses of it. And all of the law enforcement agencies that have chosen to carry it in their cruisers, it's there. We're making it available everywhere. We've done some community education here that's been set up through Mental Health and Recovery to teach people how to use the the Narcan that you can buy locally. I mean, a lot of the local pharmacies are carrying it over the counter. We're doing our best to educate, but once again, we're on the treatment side. We only see it after the fact. But what you're saying is absolutely true. And prevention, I think, has got to be the key. And treatment is important. And what we're doing is getting it done. But how many we've saved, I can't really speak to that. But every person we get to that is viable, meaning they have a pulse, we can help them. The problem is we've had quite a few of those 9 that were way gone before we got there. Narcan is not a miracle. It is a medication that we can use if the patient is viable. If they're not, there's not much more we can do for them. So the key is awareness, getting it out there, making sure that people know that we can only do so much. And I appreciate the support from all levels to make sure that we have the medication and the tools to do the job.
You know, if I could add one thing, we think that about 3/4 of the people who are on heroin started with pain meds. And I think we've come a long way, but I think we still have a ways to go. We're still finding, I'm not referencing here necessarily, but we're still finding places where, you know, someone goes in, 20-year-old goes in to get wisdom teeth taken out, and they're given prescription of, 30, 35 pills. And there's nothing good that can come out of that. Either they're going to take them all, which is not good and risk becoming addicted, or they're going to sit in the shelf, and then bad things happen when they're in the home. We don't know. They get stolen, they get used, whatever. So part of it, I think, is we have to continue to, try to work to change our culture. These are not bad doctors or bad dentists who are doing this, but it's a culture and it's an understanding. We want people, if you have cancer, if you have horrible pain, no one wants to see them suffer, and they need to get whatever it takes. But on the other hand, if someone's got their wisdom teeth out, they probably don't need 35 pills to get through the next few weeks. It's just a lot of it's common sense. A lot of it's just paying attention and being attuned to that. So, and I think, I think it's important for parents, who and other people in the family, when they got a prescription that's that big, to say, look, I don't need all these, or you don't need all these. You need a couple maybe to get through. But so we got to look at this from kind of a holistic point of view and go back that, a lot of this does start with people becoming addicted to pain meds. And that has not changed, and so we still have to go back and try to fix that as much as we can too.
And once again, thank you very
Thank
much
you all.
for your attention, Senator.
Can I just change the subject just for a minute while we have you here? I want to commend you for what you've done with the sexual assault kits across the state of Ohio. I think that's
Thank you.
Really awesome and a real friend to a lot of victims across the state of Ohio. And I know that the Senate passed Senate Bill 316 to have law enforcement provide the kits within 30 days.
Yeah, get them into the lab within 30. Yeah.
And I just wanted to see what kind of follow-up, what kind of compliance you're getting, and is that the end solution? Are we there? When you leave office, which unfortunately you're going to have to do, is it institutionalized enough that we won't have that problem in the future?
Well, it's interesting. Right after I became Attorney General, we heard about these old rape kits sitting around, and so I put a group together to come up with a protocol about when rape kits should be tested. And they basically said, these were victim rights advocates and prosecutors and others. They basically said, look, every rape kit should be tested unless there's no crime. No crime would be the rare case where someone reports that they've been raped, and then a couple of days later they turn around and say, well, we had sex, but it was consensual. That's not a crime, and those should not be tested. But every other one should be tested. And so we sent that letter out to every law enforcement agency, and we started getting these back in. I'm rounding these numbers off as best I can remember, but we got about 8,000 or 9,000 in. But after the legislature passed that law, we got another, I think, 3,000 in. So even our letters, even everything else that we had done, all the publicity, for some reason, some departments were still holding on to these old rape kits. And so, I at least feel good that once the legislature said it's the law now, it's not just Mike DeWine saying it, but it's the law, then they brought them in. So I think that becomes the norm now. I don't know there's any way to assure that there are no rape kits ever out there that people are not holding on to, but I think we've changed the culture. And I think everybody now understands they've got to be taken in. And so I think no matter who's Attorney General, that's going to, that's going to continue. And I think that, it's, as you point out, it's the right thing to do to protect the public. It's also the right thing for the victim. The victim now knows that, if they consent to the examination and have their clothes taken and all the things they have to do, that at least that's going to be tested. And we really learned something. We've been consistently running somewhere between 36 and 40% matches, no matter where it was in the state, no matter where those rape kits came from. So that means that in better than a third, when we put those in the national database, we get a match. And in most cases, that match means we know who did it. In some cases, it's a match to another unknown. And then we at least can go back to all the departments and say, you've got the same rapist. We don't know who he is, but you've got the same rapist. So it's invaluable information, and it's going to continue to be valuable because it's in that database, and the ones who have not hit yet, we have unknowns in there. That guy is going to mess up sometime, and they're going to arrest him, and when we arrest him for a felony, his DNA is going to go in there, and we're going to get a match, and we're going to know that case, 5 years ago, 10 years ago, we now know who committed. So thank you for the question. I feel very good about where we are in the state today. Thank you all for your time. Appreciate it.
Thank you.
Very much.
Okay, on the old business, sewer district contract. We are assigned to you, discussing the topic, no, sewer district contract, that needs to be renewed. Is that
Yes,
right?
the contract actually expired at the end of.
Yeah.
Okay, go ahead, I'm sorry.
At the end of 2016, Charlene sent up the new contract, and I had sent it out for your review. I know there was some conversations with Charlene that maybe we do this for potentially a year, and she was okay with that. The original contract said 3, and the previous contract before then. So just wondered your thoughts, if you had a chance to look at the contract. I told her we would bring it up Tuesday, and we got to talking about other things. We had CDBG in there, so we got talking about other things, and we didn't get to bring it up on Tuesday. So I want to make sure we brought it up for her today.
Yeah, I do have a chance for your thoughts.
I'm fine with the 1 year, if that's the interest of doing that, that's fine. I didn't have any other comment on it.
Yeah, that's fine. Will you have a tickler so that it can go into our agenda at the end of every year? So that
Yeah, and if we do, when we do it at the, end of this year for 18, we can talk about it again and do a 3-year. Because we have historically done a 3-year.
Okay.
So I'll accept the motion to,
So moved.
thank you.
Second.
Thank you. Roll call, I guess.
Give me a second.
I'll give you a second.
Okay.
Commissioner Thomas?
Yeah, Commissioner Thomas,
Yes.
Commissioner Stacy,
Yes.
Commissioner Kirschner.
Yeah. Opioids. The reason that we have this on here is we had a little bit of consternation about opioids over the past 12 months. And I wanted to say that the office was totally cleaned out. The space was available on time. In fact, it was better than we had envisioned it might be. It was absolutely very well done. And I would like to give credit where credit's due. I don't know if anybody else had a chance to view the space or not, but I think this guy was down and was extremely happy with the way it was.
Mhm.
They were gone the day that they were asked to be gone. We supplied a dumpster, and that was taken care of, so, the person's name,
Diana?
Diana Warneman. I would like to say thank her on behalf of the Board of Commissioners for doing exactly what she said she would do. And that place is ready now to start construction for the Board of Elections. So we're happy as we could be with that. Any other old business?
I did wanna add, airport.
Okay.
We did get the paperwork for the vacation request of that, section of road that's out at the airport. The airport manager did submit that. We will be waiting for
That's the little
the
stub where the house was going in.
little, the little, it's actually listed as a road, so it has to
Okay.
be a vacation of the road. And it's a township road, but they have reviewed it and they were okay with it. We're just waiting on a legal description now. Did want to give you a little bit of an update that, because of the way the FAA supported the removal of the other house, this will come back on the general fund to remove that road. And I did talk to Brad briefly today, that he had an estimate of about $6,500 to $7,000 for the removal of that road. And then the additional tree removal, he had both of those in one estimate for $5,500 to $6,000. Just wanted to let you know that once he gets the vacation in place, then we'll have to decide, get that money appropriated, if we don't have that in.
Did he give you an indication as to whether the homeowners and him would come to any,
They're done, everything has been,
they've all agreed to
Yep.
whatever? Okay,
Yep.
good. So that's good news. Any other?
Nope.
Any other business? Any, new business besides the appropriations?
I wanted to just mention briefly that yesterday the Auditor of State, Auditor Yost, released the new physical tool to help cities and counties avoid fiscal stress. Don't say that too fast, but anyway, there was a nice, the editorial today and the Advertiser Tribune alluded to this news release that was put out, and it's a lot of, there's 17 different indicators, and this again, looking at the financial health of, they did this for every county and municipality in the state. Through our County Commissioners Association, they communicated with us last Thursday that preliminary numbers were going to our fiscal agents, which in our case is the county auditor. And on Thursday, there was opportunity for the auditors to look it over. On Monday, there was a conference call that we were able to call in to ask questions, see how other counties were feeling about the data and all that kind of stuff, and that they were releasing it off of the auditor's website and a website of its own about this whole thing. And we are in green, which is where we want to be. You're either green, yellow, or red. And green is good financial health, and we are green in all of the 17 areas that are looked at for this, and this is based off of data through 2015. So actually all of the work we did for the bond and things for the Justice Center wouldn't have played into this because that was done last year in 16. But anyway, since there was the editorial today, we didn't have any media calls on it, but we wanted to include the fact that it was out there. We're pleased with where we stand. Some digestion to do of that because it's kind of hard. As I say, you can't compare apples and peaches when you're looking at this from one county to the next because we all probably manage our finances a little bit different based on what we've got going on. How many unions you've got in your county, what you need for carryover based on your payroll and the timing of that at the beginning of the new year, to you're preparing to get good bond ratings as we did last year in 16, and so you manage funds maybe a little bit different and so forth, but something new from the auditor's state, and that's where we stood with that.
Yeah, and it is available on the auditor's website.
Yeah.
Before it's so defined. I think it's important to note that not all counties were all green. I mean, we were exceptional in that, and relative to municipalities as well. So clearly, Stacy and everyone has done a nice job of managing our finances. Or we could say, since I've been here, we're all green.
Good news, just keep rolling it
Right. Yeah, yeah, and Carrier's opening a plant here too. I was here first, Jimmy.
All That's great stuff.
You wanna go ahead with the Seneca County grade again?
My goodness.
Okay, supplemental appropriations, new business, I'll
Sure.
start.
I have a supplement to the permanent appropriation to the commissary fund, putting $15,000 into other expense. I have a resolution authorizing Seneca County Board of Commissioners to enter into an agreement, Seneca County General Health District for 2017 nursing services on behalf of the Seneca County Youth Center. Also have a resolution authorizing a contract service agreement with Huron County Board of Commissioners for the receipt, custody, and care of Huron County juveniles on behalf of the Seneca County Youth Center for 2017. And those are the resolutions I have today.
I'll move to accept.
Second?
Second, okay, roll call please.
Commissioner Stacy?
Yes.
Commissioner Thomas?
Yes.
Commissioner Kirschner?
Okay, now it's time to, ask for any comments from the gallery, from the audience. We lost most of them. Charlie, you had your say today, right?
Happy to say.
Okay. Anyone who's way in the back there? Mr.
Stranger.
Kirschner, what do you say?
Don't give him the floor.
No, he gets paid
Paid
by.
by the word. I've seen him cross-examine people.
Okay,
Just a reminder, we are having board on Tuesday, 10 o'clock. We've added another
Special meeting, yes.
regular session, we can add when needed, and I guess the main topic will be Wolf Creek, so, that agenda will go out, Monday. We
Mhm.
can send out on Monday, but I would do one online for everybody with board session on Tuesday.
Deep topic.
Deep dive.
Tally that one.
I will entertain a motion for adjournment.
So moved.
Second.
Good. You're adjourned.